Medicare change and choices in 2026. Today, we're going to talk about coverage, cost, and change. And we're going to talk about whether the empire is striking back. So stay tuned. It's going to be an interesting discussion on Medicare coverages. I'm going to turn it over to my business partner. This is Bill Witt, turning it over to Tara Kendrick. She'll start us off.
Hey, everybody. Good morning. Thanks for joining us today. All right, so we're going to jump right in. The problem that we're having today with all these changes for our Medicare plans and people who are on Medicare is most people rely on this healthcare in retirement. I mean, unless you have some sort of a nice plan with your previous owner or previous employer, usually people will jump to Medicare to pay for their healthcare. A lot of this stuff can be super confusing. And as you're noticing, if you've been watching the news, it's always changing. So we wanted to try to make it simple for everyone and give you the most up-to-date information that we have as currently today, November 4th of 25. Not all of the numbers have come out yet, but we just wanted to make sure that you know what some of the current upcoming changes are for 2026. All right, so today's topics, we're going to talk about what Medicare is, the changes in 26, the choices, and the 3 C's: coverage, cost, and change. All right, so I think most of us who are on the call know this, but Medicare is health insurance for people 65 and older or who have certain disabilities or end-stage renal disease, and it's managed by the Centers for Medicare and Medicaid Services. And then it's augmented by private insurance companies. And that's when we talk about advantage plans and supplement plans. And where you sign up for Medicare A and B is at the website ssa.gov, or you could go into your Social Security office. Okay, so if you were to come in our office and talk about Medicare, we have this one-page, super simple way to understand Medicare. So on the bottom left, you see Part A and B. That's your traditional Medicare. The numbers highlighted in yellow are the numbers that are going to change for 26. They haven't come out yet, but the Part A deductible will change, your Part B premium, and then the Part B deductible is going to change. So you just keep watching for those. And on the left side, you have if you get A and B, you can add a supplement plan, and then you have to add a separate drug plan. And then you can also choose, instead of that, is to sign up for A and B and then get an advantage plan, which is a privatized version of Medicare that covers both your health care and your drug plan. So in 2026, nothing's going to change with the number of plans, options they have, A through N. These are government standard plans. It's regardless of whether you go with Aetna, Blue Cross, United, the services and the coverage always stay the same. We recommend Plan G, which is you can see 100% down the board, the best coverage, or if that one's a little too pricey, the next best is Plan N. And the out-of-pocket limit, again, is going to change for 2026.
Yeah, and Terry, you may want to go back up for a second. On Plan N, there are some small co-pays. If you go to a doctor, you pay $20. If you go to an emergency room, you pay $50. But N is good coverage. If you're old enough to qualify, you had to be Medicare age eligible, in other words, 65 by January 1 of 2020 to get a Plan F, which is what I have. And that has full coverage. When I go to the doctor, I show my cards and they go, "Bill, take a seat." Plan G is almost as rich as Plan F. The only thing it doesn't cover is the annual deductible for Medicare Part B, which this year is only $257. So G is a solid plan, no nickel and diming when you go to the doctor. But if you're looking for a more cost-effective way, Plan N is a good option too. All right, so let's delve now into where most of the change is actually taking place. What you're going to find is it's taking place in the drug plans and in the Medicare Advantage plans. And so let's talk about drug plans. Drug plans are annual, as are Advantage plans, and they start on January 1, they end on December 31st. And every year we have a chance to switch from one drug plan to another. And that window is from October 15th to December 7th. And you make your decision on changing at the Medicare.gov website. And it's very easy to use. So what you can do is you go to Medicare.gov in this open window time frame, and you build a drug list by name, dosage, and frequency. So like lisinopril, 5 milligrams once a day. You build your drug list. You pick a pharmacy, and they're all in there: HEB, Walmart, CVS, Walgreens. They're all in there. And then the beauty of this website is it ranks the plans that are available. And in Travis County this year, there are 12 plans available for upcoming 2026. This year, there's 15 plans. So we're starting to see a reduction in plans. And we'll talk a little bit more about that as we get into change, cost, and coverage. These plans are, so you go to the website, you build your drug list, pick your pharmacy, and it's going to rank the plans, the 12 plans, by their annual cost. So they take all the premium you might pay, if there's a deductible for the plan, what your copays will be based on the drugs you take and the pharmacy you pick. And the beauty is it adds all those numbers up for you and says for 2026, here's what the cost is. If you scroll down on that page and look at other number, whoever comes in second, third, fourth, you'll see that that annual cost gets bigger and bigger. So most people, once they've built their drug list, picked a pharmacy, usually you select the plan at the top of the list because that's your best deal. Now, the plans do come with 5-star ratings. And, well, our recommendation to clients, we don't offer or sell drug plans, but our recommendation is if the plan you're picking has 2 stars or less, maybe you want to think about dropping down, because what that means is the plan has had some customer service issues. There's reasons why people aren't happy with it. But if a plan has 2.5, 3, 4 stars, you don't need a 5-star plan to be happy. So if a plan has 3 or 4 stars, grab it, sign up for it. And with each plan, there's an enroll button. So you just click on the button. Now, what if the plan you're on this year is still your best option for next year? You don't have to do anything. You'll just slide into next year and you'll start paying whatever the premiums and deductibles and copays are for next year. But if you can save money by switching plans, and 3 of the last 5 years when I've built my drug list and gone in and filed, it said, Bill, you can save $300 by switching. So what did I do? I switched. Signing up takes 5-10 minutes. You put in your information, and then your plan, your new plan, will kick in January 1 of next year, and it automatically disenrolls you from your current plan. So you don't have to call up your current coverage and say, I don't love you anymore, I'm leaving. So let's talk about one of the major changes that took place in 2025 that'll carry over into 2026. And that is that they've been reducing the maximum out-of-pocket cost for prescription drug plans. If you go back 2 years ago, there was no maximum limit. So if you were on an expensive cancer drug or some other very expensive drug, you could be paying literally an unlimited amount out of pocket to receive those drugs. Well, last year they reduced the out-of-pocket maximum to $8,000. Sounds like a lot, but if you're on a cancer drug that's $10,000 a month, that's not a lot. So last year the maximum was $8,000. This year they've dropped the maximum down to $2,000 out of pocket. That's wonderful. But what happens when you as a consumer only have to pay $2,000 and you have some very expensive drugs? Well, the problem is the drug plan companies have to make up that shortfall, since you're not paying most of the cost of the drugs once they exceed that $2,000 out of pocket. And so what we saw this year was a little increase in drug plan premiums. We're expecting substantial increases for 2026. The second piece of the puzzle that changes annually is Medicare Part C. These are the Advantage plans that Tara showed you on the right-hand side of our drawing. And once again, you're seeing a decrease in available plans. Last year in Travis County, we had 43 plans. This year, only 32. And those plans come in various flavors. Some of the plans are offering a PPO level of coverage, preferred provider network, PPO, which means you can go in and out of network and still have coverage. But if you go out of network, you pay more for the providers that you go to. Many of the plans today are HMO, which means they're wonderful as long as you're in coverage, as long as you go to a doctor, specialist, clinic, or hospital that's in network. If you go out of network, you've got problems. You're going to pay the full cost of the care. There's a third variety called HMO, POS, or point of sale, where specialists and doctors and providers can opt in or opt out. And it's based on what they take on the day that you go to see them. And then finally, there are special needs plans. These are plans, one of the more advertised versions are what you hear about it, dual eligible, people that are eligible for both Medicare and Medicaid. And those are plans that are designed for people that are on both Medicare and Medicaid. They also have special needs plans for people with specific medical conditions. And so they're tailored or tuned exactly to the needs of the person that needs care. These plans also are annual. So you have in the open enrollment window, October 15th to December 7th. That's when we have the opportunity to make a change. If we don't make a change, then you'll roll into next year on the same plan. If you go to Medicare.gov and select a different Advantage plan, it will take effect on January 1, and it'll disenroll you from your current plan at the end of the year. So these are Medicare Advantage plans. And the reason we're seeing a reduction in plans is one of the things that occurred several months ago was that Congress passed the Big Beautiful Bill. And for the first time,
the butthole bill.
The Big Beautiful Bill. Anyway, they passed the Big Beautiful Bill, and that bill reduced payment that goes to companies that offer Advantage plans. And as Tara mentioned, you can get an Advantage plan from Blue Cross, United Healthcare, Aetna, Cigna. They're offered by many, many different companies. And what's happened historically is the government, when you sign up for an Advantage plan, the government writes a check to the Advantage company for about, these are rough numbers, $12,000 per individual that signs up. If you're healthy, that insurance company is going to make money. If you're not healthy, they could end up paying out more than the $12,000 they receive. So the compensation those companies get from the government is very important. One of the things the Big Beautiful Bill did was start to reduce compensation to the Advantage plans. This year it was a 4% reduction. It may not sound like much, but we've seen a ripple effect. One of the companies, one of the major providers of healthcare in this country is United Healthcare, and they offer Advantage plans based on counties. And I think the number I saw was that they were pulling out of somewhere between 130 and 160 counties. And an example, one of our clients lives up in Lampasas County, and he's on an Advantage plan, and he was given notice that they're not going to renew that plan. So he now is faced with either selecting a different Advantage plan or dropping back to original Medicare and then adding on a supplement and a drug plan. So we're starting to see the winds of change blow. And earlier I said, is the empire striking back? The government pays out about $600 billion to the Advantage companies. That's a lot of money. And I know that the administration is looking for ways to cut costs. And we've all heard about the government shutdown, and the Democratic Party is fighting to have subsidies established or continued for the Affordable Care Act. Well, another way that the current administration is looking to save money is by reducing compensation to the Advantage companies. And that's why you're seeing some of them pull out of various markets. So let's compare the plans. This is usually where it boils down. People go, gee, do I go supplement and drug plan, or do I go Advantage plan? And so let's talk about the 3 C's: coverage, cost, and change. In coverage, when you're on a supplement and a drug plan, you can go to any provider that accepts original Medicare anywhere in the United States. So this is a good plan for people that maybe spend several months a year in a different locale. Maybe you go up to Colorado for the summers, or maybe you're snowbirds that come down from the north and spend their winters in Texas. Well, you have a lot of choice of providers. Wherever you are, you can access Medicare if you're on a supplement and on a drug plan. On Advantage plans, once again, it depends on the structure of the Advantage plan you're on. Do you have to stay in network, or do you have the opportunity to go in and out of network? Do you have special needs? So coverage can vary. With original Medicare, some of the supplements come with optional benefits like vision discounts, dental discounts, things like that. On Advantage plans, traditionally they've offered added benefits, but I put in maybe there because one of the things we're seeing is with the reduction in compensation to the Advantage companies, not only have they pulled out of certain markets, but they've also started to limit or they have eliminated some of the added benefits. And, in this open enrollment period, you often hear ads on TV for both supplements and for drug and for Advantage plans. One of the things we notice is the Advantage plan commercials, listen to them very closely. They talk in great detail about added benefits, but they don't often discuss who accepts the plan or what type of underlying out-of-pocket costs might exist if you're on an Advantage plan. So you want to do your homework when you're comparing supplements to Advantage plans. Very important thing to do is say, do the current doctors I go to and the current hospital I would choose and the clinics I may use, do they accept this specific Advantage plan if I'm going to be on one? On the supplement side, or on the original Medicare side, drug plans are separate. They are not included in with a Medicare supplement. So you have to sign up for a separate product, and often it's from a different company. You might have your supplement with one company and a drug plan with another company. When you pick a supplement, you're pretty much picking a long horse in the race. What do I mean by that? It means most people that get on supplements don't change. They stay on them the rest of their lives. Whereas with Advantage plans, you might have to switch annually to make sure you're getting the coverage you want. On the supplement side, there are no referrals going to a specialist. So if you have glaucoma like I do, I can go to the Glaucoma Institute and to the specialists that are there whenever I want to. I don't need to be referred. If you're on an Advantage plan, you'd want to check to make sure, do you have to be referred to a specialist? And does that specialist accept the Advantage plan that you're on? So how do costs compare? This is a very important point of comparison. I'm going to use supplement plan G as an example. The premium at age 65, let's say, these are talking numbers, approximately $140. Once again, it depends on the plan that you're on. Many companies offer supplements, so the premium can vary based on the plan that you're on. What is the out-of-pocket maximum if I'm on a plan G? The answer is the only thing you're exposed to is the Medicare B deductible. This year, not next year, this year it's $257. So if I'm on a supplement and I go to the doctor on January 5th, and the doctor says, and I'm on plan G, and the doctor says, Bill, the bill today is $257, assuming that's what the number will be next year, I pay it. After that, I'm bulletproof. If I need quadruple bypass surgery and it's $250,000, or I need to go to MD Anderson in Houston and get chemo, then I don't pay anything. I'm bulletproof. How does that compare with Advantage plans? Well, with Advantage plans, what we usually find is the premiums are lower. This year, I think there were 32 plans, and the premiums range anywhere from $0 up to $142 a month. With Advantage plans, you have some out of pocket, and it depends on the services you need and how those services are incurred.
Yeah,
And
they don't cover half of the things that you need to get.
okay. Our study shows that the out of pocket can range anywhere from 3,800 up to 13,900. So there can be some surprises if you're on an Advantage plan. If I'm going to compare them side by side, here's how I like to explain it. When you're on a supplement, you're on a plan that is front loaded. What do I mean by that? You're going to be paying higher monthly premiums even when you're healthy. And those premiums can go up as you age. They do go up as you get older. So premiums can increase. But I'm essentially front loading. I'm paying for my cost of health care when I'm healthy. When I get to a point where I'm starting to draw heavily against the plan, I still pay the same premium, even though I might have substantial surgeries or other medical expenses. So I call that front loading. You're paying for your health care pretty much while you're healthy, and then you're getting the advantage of it when you start drawing heavily against it. With Advantage plans, they're more backloaded, which means that you're not paying as much upfront in premiums, but when you start making major claims against the plans, that's when you'll see out of pockets go up, and that's where people are exposed. On the supplement drug plan side, if you're getting a drug plan, the premiums this year on those 12 plans we mentioned range anywhere from $0 up to $167.40 a month. And every plan has copays. Each drug plan covers a different list of drugs or a different formulary, which means you want to check once again at Medicare.gov to make sure the plan you're taking covers the drugs that you're currently taking. What if the doctor prescribes a new drug mid-year? Well, most of the plans are flexible enough. They will allow you to add a drug until the end of the year. That's not guaranteed. It could be, they don't have to, but most try to be flexible to keep their members happy. At the end of the year, if they aren't going to continue to offer that drug on a temporary basis, you'd want to switch plans. Over on the Advantage side, most Advantage plans come with drug coverage built in. So it's included in most plans, not, I say some plans, but most plans. Finally, change. And this is another, I think, important way to compare the plans. Change can be difficult. Change can be upsetting when we're forced to go to different doctors or go to different providers because of a change. And I guess the good news on the supplement and drug plan side, from a supplement standpoint, these plans have been around for over 50 years. They don't change. The premiums do increase as we get older. So you need to build that into your retirement budget. But the plans don't change. What's covered, generally the doctors that accept them, somewhere upwards of 85 to 90% of most American doctors accept supplements and original Medicare. So you have freedom of choice on providers, and you have kind of a stable platform. On the Advantage side, these plans change. So you'll want to go back to Medicare.gov annually, find what is your best financial plan, and then verify that if that's the plan you want to sign up for, do the doctors, the hospital, and the clinics you like going to, do they accept that specific plan? If they don't, in many cases, you'll have to find new doctors. On the left side, we talked about drug plans. They've been around since 2006, but they change annually, and they move drugs from one tier to another. There's preferred brand name drugs, non-preferred. There's preferred generics, non-preferred. So there's different tiers, and the copays you pay are based on where the drugs end up. That's why using Medicare.gov annually is the way to find out, am I on the best possible deal? We're seeing higher premiums in 2026. At the end of 2024,
Agreed.
President Biden was running for re-election, and he had passed legislation to reduce drug costs. Well, as we entered into 2025, the drug plan companies came back and said, here are our plans for 2025. They did this in September, October of 2024. And the premiums were going to go up substantially. Why were the premiums going up? because they'd reduced the out-of-pocket maximum from $8,000 down to $2,000. Well, drug plan companies want to make money, so they were planning to implement much higher premiums. And President Biden was able to allocate funds and pay the drug plan companies so that they wouldn't increase their premiums this year for 2025. President Trump did not pay those same subsidies to help support lower drug plan premiums. So we're seeing drug plans, the cost of drug plans going up. We're also seeing fewer choices. We keep seeing a condensing of the number of choices that are available. The same thing is true on the Advantage side. Fewer choices, dropping down from 43 to 32 plans, higher premiums. You want to investigate if you're on an Advantage plan to make sure you're still on the best deal. So I want to finish up on a topic that only affects a certain percentage of the people that listen to us and that are following, but it's an important one. And let me say this. The IRMA surcharge is what's called the Medicare Income Related Monthly Adjustment. Well, what is IRMA? IRMA is not a friendly little old lady. IRMA is a surcharge or tax that you pay based on your income. And it affects three parts of Medicare. Parts B, which is from the government. This year, most people pay $185, but you'll see that other people don't pay $185. Part C, which is the Advantage plans, and Part D, the prescription drug plans. All three of these are augmented for IRMA. And so these are the parts. The ones that I've highlighted in yellow are the parts of Medicare that are exposed to the IRMA surcharges. So how does this work? Well, the government says, what is your adjusted income? It's actually modified adjusted, but let's talk about just as adjusted gross income. And they've created income bands that if you're an individual and your adjusted gross income is greater than 106, you're going to be in a higher bracket for paying the Medicare B, Part B premium and the Medicare Part D surcharge. And while these amounts may not look like a lot, here's where the pain comes in. We have a graduated income tax system in this country. And if I'm above one of the thresholds, going, let's say, from the 12% to the 22% tax bracket, only the income above the ceiling for the 12% bracket is taxed at 22%. So if I'm just slightly above it, only a small portion of my income is subject to the higher tax. But that's not true with IRMA. With IRMA, if I report modified adjusted gross income of 106,001, I'm paying not 185 for my Medicare B, I'm paying 259 every month. If you're married, the thresholds are double, but you can see that both you and your spouse may be saddled with much higher Medicare B premiums and Medicare Part D surcharges. So just a few dollars above one of these limits can cause you to pay hundreds of dollars in a calendar year just to be on Medicare. That's unfortunate, but there's good news. There's ways to avoid IRMA. And first, we need to talk about something that's a little surprising. They base your IRMA this year on your modified adjusted gross income from 2 years earlier, from 2024. So 2026 IRMA surcharges, taxes are based on what you earned in 2024. What if you retired in 2024 or 2025? Then you're not earning what you did when you were employed. Well, it's important to inform Social Security that, hey, I was making more, now I'm making less. I've had a change of life event. It might be retiring. It might be going to part-time work. It might be a divorce. There's many reasons why we are reporting lower income. And the way you report that to Social Security is Form SSA 44. You can fill that out and submit it to a Social Security office. and they won't wait 2 years to adjust your IRMA. They'll adjust it right away. So let's say you retired at the end of 2024, earned a fair amount of income, but you're not earning income in 2025. Well, by filing Form SSA 44, if you have questions on this, give us a call and we'll show you how to do it. But the other thing to think about is you want to avoid future IRMA surcharges. And this is where you have a number of options. You can investigate products that generate tax-deferred growth. Let's say you've got some money in a CD and it's earning interest. You have to report that interest. And if it puts you into one of the IRMA categories, you might want to consider reallocating those funds into a product that grows, but where you don't have to include the growth that it's generating in your taxable income. Another important option is to withdraw from Roth accounts. Roth accounts are a form of qualified retirement funds that grow tax-deferred and then are tax-free when we take money out. And so one of the things we do in our practice is to show our clients how to gradually move from qualified funds that are taxable to tax-free Roth accounts. And if you're tapping Roth accounts, you have the income, you just don't have to report it, and it can reduce your IRMA surcharges. Another option is to delay Social Security. We've done webinars on Social Security, on ways to increase the lifetime payout. And one of the ways is by delaying Social Security benefits beyond full retirement age. Every year you delay it, you start with an 8% higher benefit amount. That's kind of nice, but it also may reduce your taxable income, which reduces your IRMA surcharges. And the last one is one that's gaining a lot more popularity. If you have retirement accounts, when you turn 73, what do you have to start doing? Taking required minimum distributions, RMDs. And those RMDs can force your adjusted gross income up into a category where you're paying IRMA surcharges. Well, let's say you're fortunate enough to go, I don't need the RMD income. You have the opportunity to donate it directly to a qualified charity using a QCD, qualified charitable distribution. That not only satisfies your RMD, so you stay in good terms with Uncle Sam, but it can reduce your taxable income, and by so doing, reduce the IRMA surcharges that you have to pay. If you have questions on any of these, this is a lot to understand, but if you have questions on this, come see us and we'll talk about ways you can reduce or avoid IRMA altogether. So what's next? Well, we're actually going to start a 6-part series starting next week on some topics, some of which we've touched on before, some of which are brand new. When we talk about financial security, which is what we're going to talk about next week, what that really, it's a series of questions that go, what does financial security mean to you? And people have different answers. But the reality is we're going to have to support our lifestyles in retirement based on what we've accumulated through Social Security, maybe other sources of income, through retirement accounts. Some of us have expensive homes. There's a number of ways to facilitate and support and maintain your financial security in retirement. We're going to talk about that. We're going to do a topic on financial.
Moving to Portugal is good.
We'll talk about moving to Portugal.
Oh, I'm sorry. Can you hear me? Oh my
We're going to go also to talk about financial planning, and that's where we give our clients a window into their financial future. We'll talk about that. We'll discuss the power of income, how that can dramatically multiply the value of your savings and add to your financial security. We'll talk about maximizing Social Security, key strategies for doing that, which benefit to claim and when. We'll talk about ways to maximize what you take out of your retirement accounts. And finally, we'll talk about creative ways, tax-free ways to tap home equity. So we've got a lot to cover over the next 6 weeks. I hope those topics will be of interest. So with that, we're going to, if you have questions on making smart Medicare choices, give us a call. Our phone number is on there, 512-835-0963. And are there any questions before we wrap it up today?
I do have a quick question. I have become disabled. I'm 62. Um, I don't know if any of this actually will relate to me because of I'm a few years under.
Well, when you're disabled prior to your full retirement age, 2 years after Social Security establishes your disability, you are eligible for Medicare benefits.
Yes, I just got them.
Yeah, so you can sign up for Medicare, and you have choices beyond just signing up for original Medicare. If you have questions on that, call us. When you qualify for disability benefits prior to your full retirement age, they actually pay you what you would have gotten when you're full retirement age, which for most people today is 67. So when you qualify, you get that higher benefit, and your benefit is disability income until you hit age 67, and then it converts to normal Social Security retirement income. So any other questions today? Well, if not, thank you for joining us. Look forward to having you join us next Tuesday, talk about financial security.
Thank you.